Quality of life data from POLO showed that both arms were well tolerated. Now, I think one has to just keep in mind that the quality of life levels for people entering the study was high in both arms, which is quite good. I think the PARP inhibitor overall was relatively well tolerated, anemia, fatigue, and some GI toxicity for the most part. And after a certain point, there were not an adequate number of patients to be able to evaluate sequential data. So it's a little hard to interpret, but I think it resonates with what we see, that when pancreas cancer is well controlled, as it was on both arms entering the randomization phase, the acute symptoms of the disease are much improved for most people, and that quality of life is relatively speaking relatively good. I think it's a little bit of a surprise that there wasn't a difference between placebo, but again, it's relatively small numbers, and I think we have to keep an open mind on that.